follows this principle on the issue of pre-existing conditions. The Republican bills and the Democrats all say that nobody in America should go bankrupt, and nobody in America should be forced to lose their home or not pay their grocery bill because they are simply unfortunate enough to have MS, which can cost $50,000 a year to treat. Or for that matter, to have AIDS, which can cost $15,000 a month to treat. We pretty much decided as a nation that if you are unlucky for reasons beyond your control, and I think I set aside the issue of taking care of ourselves. We all know that we need to engage in mental health crisis. I need to lose weight. Anybody in this room that still smokes needs to quit. If you have high blood pressure, you need to get it treated. If you have high cholesterol, you need to get it treated. But putting aside those things over which we have lifestyle control, if you look at MS, or you look at breast cancer like Elizabeth Edwards, or you look at some other disease that's outside your control, Americans have pretty much agreed that we shouldn't be allowing people to lose their homes or not be able to buy food, put it on the table, or pay their living expenses because they're unlucky enough to have one of those diseases. So, I think there's bipartisan agreement on that issue. What is the bipartisan agreement? Well, the Democrats in this bill, the majority of the House in this bill, say that they would like to have what's called guaranteed issue and community rating. Guaranteed issue is law in some states already. What it means is that the health insurance industry could no longer decline to cover you by giving you a medical exam and saying, oh no, we're not going to cover you because you have MS, or you have heart disease, or you have diabetes. The guaranteed issue says that the insurance industry would write a policy for everybody, no matter what their sickness was, and they would, secondarily, in this bill, they use what's called community rating, which means they charge everybody the same rate. Now, I don't think that's the best solution for pre-existing conditions, but I don't think it's the worst thing that could ever happen. I think the idea of having someone in our society who can't pay their medical bills because they're $15,000 a month or $4,000 a month is a bigger problem. Republicans solved that bill, that issue, pre-existing conditions, in a different way. When you leave here tonight, you'll be able to get from my staff a copy of the summary of my bill. My bill is called the Improving Healthcare for All Americans Act. And on pre-existing conditions, it simply says they ought to fix it by creating what are called high-risk groups. What's a high-risk group? 3 years ago, the United States Congress actually took a bill I wrote on high-risk individuals and passed it. It passed the House, it passed the Senate, and it was signed by the President. If you want a copy of that bill, you can get it when you leave here tonight. What it did was it went at the problem on high-risk pools. Some people say Republicans had a chance to fix up there when they were the majority and didn't do anything. It is not true that they didn't do anything. Because we passed my bill. I know it because I wrote it. Now I will tell you, I don't think Republicans did enough to fix the problems in health care, and I wish we'd done more. But here's how a high-risk pool works. Let's say you live in Arizona. Let's say you have MS. Let's say you apply for health insurance in the individual market. Let's say you are turned down and told you won't write a policy for you because you have a pre-existing condition. Or, like my oldest sister who has breast cancer, and thank God is a breast cancer survivor now for 20 years, if she were to leave her job, apply in the individual market for a health insurance policy, they would no doubt, in the individual market, turn her down and say we won't write a policy that covers you for breast cancer. What this bill says, or they might, some insurance company might say, well, we'll write a policy, but we won't cover breast cancer. Or they might say, we'll write a policy for you, but it will cost 6 times as much as the policy or the rate of premium we would charge to somebody who doesn't have breast cancer or MS or whatever the condition is. What my high-risk pool bill said was that individual could apply to join the state high-risk pool. They would be, the law would require the high-risk pool to insure them. It could charge them a premium over and above the same rate it would charge as a premium for anyone who didn't have that pre-existing condition of perhaps as much as 10 or 15%. So they pay what a healthy person paid plus 10 or 15%. That wouldn't break anybody or keep anybody from, or cause anybody to be foreclosed out of their home. But where would the money then come from to pay for the additional cost of their health care? Under my bill, that cost, society has kind of agreed we ought to all share. So under my bill, it's either paid for by the taxpayers contributing to that fund, or by all the insurance companies that sell health insurance in that state contributing to the high-risk pool. The good part about that bill is it passed. The bad part about it is it wasn't compulsory. It wasn't compulsory in this sense. It said that all 50 states will be given, if they ask for it, some money to create a state-based high-risk pool to cover those with chronic conditions, and they'll be given some money from the federal government to operate the high-risk pool and to cover the health care costs of those who are very sick. But it's up to the states to decide to create that pool or not. Unfortunately, not all 50 states chose to do it. 22 states have created high-risk pools. Some of those high-risk pools are well written and operating quite well. Arizona, to date, has not chosen to create a state high-risk pool. This is the point at which I want to say, you have a wonderful representative out here, Sam Crump. We need to get Sam Crump to drop, or some other member of our legislature to drop, a state-based high-risk pool, so that anybody in that position would not be forced to go bankrupt because they were unfortunate enough to get one of those chronic conditions. The other way that I think all members of Congress, Democrats and Republicans, can agree to fix the high risk of people with very, very extreme costs is called risk adjustment. Risk adjustment is yet another mechanism that the insurance industry understands and politicians who watch it can understand. That's a system under which you would not put everybody in a who is sick and have expensive bills in a high-risk pool. You would leave them in the plans they're in. But at the end of the year, all of the insurance companies doing business, for example, in the state of Arizona, would produce their records. If you had some insurance companies whose pool of insured people was relatively healthy, so they paid very few claims for people with very expensive chronic conditions, like perhaps AIDS or MS, multiple sclerosis, they would have a low subpayment. Some other insurance companies might have had a more sick pool that had more people with chronic conditions, and they literally transfer money back and forth. They essentially risk adjust the cost of insuring people with chronic conditions. I believe there's agreement on that issue in America, and I believe we can pass that kind of legislation if we'll get beyond kind of the partisan fighting. The second issue that I want to talk about is the issue we talked about of the uninsured. Interestingly, it was the issue on which the fewest Americans, or the fewest people in this room raised their hand and said that was their number one concern. I would suggest to you that in this nation, we have already decided that nobody should go without health care. And I would suggest to you that we've already enacted laws to cover that. But what I would suggest to you is that the law doesn't work very well. Everybody in this room, I think, knows that if you go to a hospital emergency room in America and you do not have insurance or any means to pay, you get treated anyway. That is the law in America as a result of a statute passed by Congress called Townhall. It's the Emergency Treatment and Active Labor Act. It was passed out of Congress, I believe, in the 70s. Its primary author was a guy named Pete Stark. And you can agree with it or disagree with it, but it really does mean that nobody came here tonight driving past somebody who was dragging his leg down the street because it was broken and he couldn't get it set. That doesn't happen in America today. Nobody got here tonight driving past some woman who was going down the sidewalk because she had tuberculosis and couldn't get it treated. We have already decided as a social policy that Americans should get some level of care. What I would suggest to you is that delivering that care in an emergency room is a bad idea. And what I would also suggest to you is that doing it in an emergency room under the current structure, where the government does